Professor James, Dr. Code and Duncan Black were said to be very impressed with the Hyperbaric Oxygen Treatment facility at 16 Flint Road. They were given an up-close and personal view of the mechanics and tested out the chamber for themselves. Professor Philip James is also a distinguished author, having published a book called Oxygen and the Brain, and is in the process of writing his second. He is also the pioneer in research into multiple sclerosis with the use of hyperbaric oxygen treatment.
Well, it's an astonishing investment, and it's in the community. And part of this is actually to move away from hospital-based care for things like problem wounds into the community, because as everybody is finding with an aging population, community-based healthcare is much more cost-effective. We don't have to bother about beds, and we can actually provide a high level of care. If you take something like problem wounds, then it's in a perfect setting to provide oxygen as an adjunct to the treatment and to bring everything together. And so I have to pay tribute to James Pratts and everybody involved at that centre for actually having the energy and the drive to form it. And now it's performing a very valuable community service.
Dr. Bill Code is a board-certified anesthesiologist in Canada and the United States. He recruited and taught anesthesiology residents and also spent 6 years in brain research and drug therapy for chronic pain. At the age of 42, he was diagnosed with multiple sclerosis himself and soon began seeking healthy, non-drug solutions to manage the neurological deterioration, depression, and pain.
What we're trying to do is tie in all the pieces that fit so well together. So MS I've had for 20 years. My background is an anesthetist. Of course, I've always been interested in oxygen. And then a little over 2 years ago, I learned about the possibility of hyperbaric helping my own illness. And it's profound in what it's done. It's dramatically improved my cognitive thinking ability. It isn't talked about much with MS, but at least 70% of us have cognitive problems. You can't think, you can't problem solve. A further extension to that, there's 70% of us with multiple sclerosis also get headaches. I get terrible headaches, and oxygen is brilliant to help headaches. So in combination of those two things, I became acutely interested once I had read Dr. James' book. My passion now is to write books and educate people on how to help the brain recover, whether that's a stroke, a traumatic brain injury or a concussion, repeated concussions, or it might be early dementia, Alzheimer's, and even Parkinson's. So we can do so much more for the brain than we could before.
Also on the rock is cardiovascular surgeon Duncan Black, who played a prominent role in the recovery of a casualty in the 7/7 London bombings in July 2005.
The particular patient that I was involved with had the most severe injuries. He, after much surgery, repeated surgeries, he survived. At the time of the surgery, he required 73 units of blood, if not more, but it was at least 73 units of blood. And there were a team of 3 of us surgeons working on him, and he was really severely injured. He had a cardiac arrest during the procedure, and his post-operative course was extremely challenging and difficult for him. But eventually he got out of hospital. Unfortunately, he lost both his legs at differing levels, and he had other setbacks along the way.
After their visit to the chamber, they took part in a lecture on MS, MRI and oxygen at Bleak House, bringing their combined knowledge to a group of local medical professionals and talking about the benefits of hyperbaric oxygen treatment.